Welcome everybody to the HealthChain webinar. Thanks very much for joining us today. So we are here today to launch this call for expression of interest, so to become a leading SME. And today we will be going in depth to the Croatian challenges, so the challenges proposed by Rijeka Hospital in Croatia. So my name is Maria Bernabé. I work as project manager in Tech Biomed, together with my colleague Elena. So let me share with you some housekeeping rules. This session, as you can see, it's been entirely recorded and will be available on our webpage, on our HealthChain webpage after the session. And now all participants have their microphones muted, and you will have the chance to open your microphone if you have any question during the Q&A session. During the session, you can type your question in the Q&A box that you can find in the bottom of your screen. So please send us all the questions, thoughts, and concerns you may have, and we will be addressing them at the end of the presentation during the Q&A session. Then if you want to say something, so you can just raise your hand, and we will give you the floor to speak at the end of the presentation. Well, let me share with you some details regarding the HealthChain project. So then we will move to the expression of interest. HealthChain project is an European project, and it's funded through the I3 instrument. And the main objective of HealthChain project is to bring public and private sectors in the regional ecosystem that we have in the project, with the aim to develop demand-driven approaches to co-create digital solutions. So the digital solutions are being co-created between the healthcare organization and the IT companies within HealthChain. So this is a participatory-based innovation project. Our objective is to connect regional and European stakeholders within the consortium, and we will be building regional ecosystem among the different regions we have, the 5 regions at HealthChain. And we will be promoting as well the digital transformation of the healthcare organization, the 5 healthcare organizations we already have in the consortium. We will also boost the competitiveness of IT companies. So we have several IT companies in the different regions. So we will support and help them to increase their competitiveness after and beyond the project. In terms of the interregional component, is one of the key components of this project is the interregional. So we have 5 regional ecosystem, and the consortium is made up by 20 partners. And today we have focused in the Primorsko-Goranska regions in Croatia, but we have other 4 regions in the Netherlands. It's Netherlands. In Spain, Murcia region, in Portugal, Central, and in Slovenia, Western Slovenia. So at the end of the day, the main goal is to increase the capacity of this regional innovation ecosystem in this emerging region to participate in global value chain. So they are co-creating and collaborating at the regional level, but also exchanging knowledge across the 5 regions. As for the expression of interest, it's pivotal that you know that you can apply for these 2 Croatian challenges by 16th of February. This is the deadline to submit your proposal. Then, as in terms of budget per SME, I want to highlight that the maximum budget that you will receive is the 70% of 81 key. So you have to justify this amount, this budget, to get the 70%. So the European Commission will reimburse you the 70% of the budget of your project. So the cost that you incur and the cost you claim in your project, it will be reimbursed the 70% of this quantity. Okay, so if it's less than this amount, you will receive the 70% of this amount. But this is the maximum you can claim, the maximum cost of you can create a budget of this amount to receive the 70%. We are looking for, in that case, 2 SMEs, so 10 in total in the entire project. But for the Croatian region, we are looking for 2 SMEs, so 1 per talent, and they will be part of the HealthChain project. So they will become leading SME and partner of the HealthChain project. When it comes to the eligibility criteria, we are searching SMEs, small and medium-sized enterprise, but this is not mandatory, so we will prioritize this type of organization, but other type of companies will be able to apply as well. As for the geographic criteria, this is a mandatory criteria, so the SMEs must be located within the same country as the healthcare organization is proposing the talent. So in that case, we are looking for 2 SMEs from the Primorsko-Goranska region or from Croatia, from the country of the organization, the healthcare organization. This is the main benefits to become a leading SME. So you will be co-creating and piloting an innovative solution, an innovative digital health solution for the talent you will be addressing by the Rijeka hospital. You will get also business support from experts within the consortium and IT companies, so from the ecosystem supporters and IT companies in HealthChain. And as I just mentioned, you will access funding up to the 70% of 81,320 euros. So this is what the European Commission will be reimbursing you. Network with other European SMEs, so you will have the opportunity to explore and to network and matchmake with other SMEs at European level for future projects in your organization. In terms of responsibilities, the first stage, so when you, once the SME will be selected as leading SME, this SME will sign the grant agreement and enter the project as a HealthChain project partner. This will be between February and March 2024, after the selection of the 10 SMEs. So the first step is to understand the challenge that you will be addressing and the solution that you will be co-creating with the healthcare organization, and the follower SME, because in a second stage of the project, in a later stage of this process, we will have to select and award a follower SME that will be jointly co-creating this solution with the leading SME and the healthcare organization. So the leading SME will be leading the co-creation process, but they will need to allocate part of the work and the tax to other SME that will be awarded through an FSTP call. So this FSTP call will last 2 months, and you will be, as leading SME, you will take part in the selection process. Then the pilot deployment will last 12 months, and it will start in September 2024 until August 2025. So here the team of the 2 SMEs will be piloting and co-creating this solution in a TRL between 5 and 7. And in this part, the ecosystem supporter from the 5 region will be providing business support to these companies. Sorry. Okay, so the last slide is regarding the informative webinar we arranged. So we had an informative webinar on 18 January. So here you can have a look and watch a replay of this webinar to go in depth with the expression of interest details. So here you can find everything in more detail related to the expression of interest. So now let me share. Okay. Now we will go in more detail to the challenges, to the Croatian challenges. So I will share the screen for Teodora. Okay. Now, Teodora, the floor is yours. You can start introducing the Croatian challenges proposed at Rijeka Hospital.
Thank you, Maria, very much. So, hello everybody, odnosno dobar dan svima, suradnicima, cijenjenim slušačima, kolegicama i kolegama. Ja bih sada rekla nešto o našim tim kliničkim izazovima koje smo izabrali nakon što smo glasovali, a prethodno imali 20-ak prijedloga. I sad smo izglasali neke naše kliničke izazove koji bi mogli pomoći našim bolesnicima i učiniti im bolje prognoze, bolje liječenje i bolju skrb. Ja sam Zaninović-Jurjević, kardiologinja KBCRI, Klinike za bolesti srca i krvnih žila u Primorsko-goranskoj županiji. Nešto o našem kliničkom bolničkom centru koji je jedan od 5 kliničkih centara u Hrvatskoj. To je regionalna bolnički centar koji pokriva 3 županije, Primorsko-goranska, Istarska, Ličko-senjska. Ima zaposleno 3456 ljudi. Obnaša medicinsku skrb za otprilike više od 500.000 stanovnika. Imamo 1069 kreveta i imamo veliki obrtaj. Dakle, hospitalizira se više od 45.000 bolesnika godišnje, to je ukupno 300.000 dana hospitalizacije. Veliki je ambulantni pogon, ambulatorni bolesnici, ima ih oko 600.000, a imamo i dnevne bolnice, takozvane, gdje borave bolesnici zbog terapije i dijagnostike i to je oko 190.000 kreveta koje pružamo. Dakle, veliki centar u Hrvatskoj. Naši izazovi, kao što sam kazala, mi smo imali promišljanja i razmišljanja na temu naših kliničkih izazova. Dakle, sve se svodi na jedan oblik boljega i kvalitetnijeg i pristupačnijeg bolesniku praćenja, jer to je de facto telemedicina, to je skrb za bolesnika koristeći informatičku tehnologiju, a pružanje skrbi i bolesnicima na udaljenim lokacijama. Kako god okrenemo nešto što je udaljeno, a što možemo smanjiti bolesnikovu, recimo, angažman ili bolesnikova dodatna opterećenja, a da bi on imao kvalitetniju skrb i jednako dobro bio liječen, a pri tome ugodnije i lakše. Dakle, 2 su naša bila izbor od 20-ak koji smo predlagali. Jedan je Medilink, to je kratica, a drugi je FallPredict. Medilinkom bismo mi omogućili olakšanje komunikacije između specijalista u kliničkom bolničkom centru i liječnika obiteljske medicine u udaljenim krajevima. Primorsko-goranska regija je geografski rascjepkana, ima otočja, ima gorske predjele i na taj način tom telemedicinom koja može biti simultana ili nesimultana, recimo simultana je istovremeno mi dobijamo podatke o bolesniku, a nesimultana pohrana podataka koje poslije mi analiziramo. Ovo bi bio jedan oblik simultane telemedicine, stoga što bi se povezali kardiolozi sa obiteljskom medicinom, u istovremeno bi mogao biti prisutan tu i bolesnik i na taj način se na udaljenim mjestima od kliničkog bolničkog centra može pružiti skrb u ruralnim regijama, primjerice takvim bolesnicima. FallPredict je, pardon, možemo se vratiti nazad. Ok, moći ću reći sad nešto o Medilinku, podrobnije.
Sorry, Dora, can you let
Maria,
me
maybe
know
one
when I
slide
should...
before, just to say about FallPredict, a few words.
Okay, then please let me know when I should move to the next slide.
Sorry, everything is fine, thank you. I drugi naš prijedlog je FallPredict, to je, odnosi se na bolesnike koji su hospitalizirani, pogotovo na klinici za bolesti srca i krvnih žila i pogotovo na jednom zavodu gdje su bolesnici koji su stariji, koji su krhki, teže se kreću. Ne bi li se omogućilo takvim bolesnicima sigurnije hod, gibanje po odjelu, po klinici, a pritom da su zaštićeni preventivno mogućeg pada koji može imati neke posljedice kao što su teže ozljede i slično. Znači, to bi bilo to. Možemo dalje. Yes, Maria, please. We can go further. Okay. Glavni jedan opis, odnosno glavni cilj je tog Medilinka bi bio taj što znamo da je pobol i smrtnost kardiovaskularnih bolesti prva u Hrvatskoj, prema tome, a jedno od značajnijih u starijoj dobnoj skupini je zatrivanje srca. Ako je ono 1 do 2% u starijoj populaciji, to je oko 31 do 62 tisuće bolesnika u Hrvatskoj. Važna je rana dijagnoza, pravovremeno liječenje i bolja prognoza. Mi imamo već tradiciju od možda i 6-7 godina da iz kliničkog bolničkog centra naši specijalisti odlaze u dislocirane ambulante Gorskog kotara 2 do 3 puta mjesečno. Ovim načinom bi ostvarili cilj da bi stvorili jednu telemedicinsku platformu kojom bi na udaljena mjesta, na udaljene lokacije mogli olakšano komunicirati sa liječnicima obiteljske medicine, bolesnicima i pomoći im u liječenju. Može dalje. Tako da, to bi bila platforma, portal ili aplikacija sa jednim sigurnom komunikacijom pravovremeno, dakle upravo bila simultano u to vrijeme kad se to zbiva, razgovor s bolesnikom i liječnikom obiteljske medicine, tako da bi eventualno bilo bi jako dobro integrirati određene medicinske uređaje koje bi također digitalno prenosili recimo zvuk, ton, primjerice stetoskop koji se može prisloniti na bolesnika, pluća, srce, trbuh, gdje god i time slušati određene zvukove koje mi možemo onda kao specijalisti interpretirati i dovoditi do određenih zaključaka tamo koja je bolje liječiti ili usmjeravati. Znači digitalni fizikalni pregled, vrlo privlačno i vrlo, vrlo lijepo i dobro. Može dalje, please. Further. U tom pogledu, što se tiče Medilinka, mi bismo angažirali 5 kardiologa suradnika u KBC-u koji bi omogućili potrebito. Onda bi također razgovarali sa obiteljskim liječnicima i njima kazali o čemu bi se tu radilo i naravno dobili njihovu privolu i tada bi koristili, validirali tu soluciju. S druge strane, obiteljski liječnici bi također bili spremni angažirati se oko bolesnika koji bi na takav način komunikacije pristali, upotrijebili bi validirali tu soluciju, a bolesnici predviđeni koji bi participirali u tom pilot projektu bi ih trebalo biti oko 25. To je naš cilj. Please. Mi očekujemo da ćemo na taj način osigurati poboljšanje pristupa specijalističkim pregledima, odnosno brizi koji pruža specijalistički nadzor. Učinkovitost će biti bolja, bolesnici će biti jednostavniji, pristupačniji će biti kontakt sa specijalistima, smanjit će se odgađanje liječenja, bolji će biti na koncu i zdravstveni ili medicinski ishod u takvih bolesnika u udaljenim krajevima u odnosu na KBC. Tako da bi se moglo reducirati nepotrebni troškovi bolesnika koji bi bili u bolnicama i dolazili na preglede. Očekujemo redukciju otprilike 7%, a Likatova skala koja nam daje jedan sliku zadovoljstva takvog načina rada, očekujem da bi bilo barem 60% pozitivnih odgovora s obje strane. Please further. I ako bi taj pilot projekt bio uspješan, onda bi KBC Rijeka nekom internom dogovorom mogao odlučiti da bi se takva inovativna jedna solucija mogla i dalje primjenjivati i omogućiti tako bolesnicima. FallPredict je isto jedan vrlo zanimljiva naš klinički izazov, zato što je to pravovremeno, u pravom vremenu monitoriranje bolesnika dok su oni neovisno za vrijeme hospitalizacije, dok se neovisno od tuđe pomoći gibaju i pomiču i hodaju i skrbe o sebi tijekom boravka u bolnici. Mi znamo da se nadzor nad bolesnicima, pogotovo starim bolesnicima, zahtijeva dosta zdravstvenog osoblja tijekom rada u bolničkim uvjetima. Mi znamo da smo u tome dosta, mislim, insuficijentni, Europa je insuficijentna, naime, mi imamo 53 kreveta na klinici, imamo 8 takozvanih specijalnih ležajeva za dnevne bolnice, imamo 74 sestre koje su u smjenama i 8 njegovateljica. Da bismo mi osigurali jednu pratnju i bliski susret i bliski boravak kroz vrijeme sa bolesnicima koji su slabije pokretni, fragilni, koji se žele ipak radi svog mentalnog stanja, bolje sigurnosti, boljeg osjećanja gibati, ustajati, hodati hodnikom, održavati vlastitu higijenu, na koncu na taj način se sigurno i bolje, kao što sam rekla, mentalno osjećati, to im daje jednu sigurnost. A opet da nemaju tu skrb zdravstvenog osoblja, da su neprestance s njima, ako to nije jednostavno mogućnost, onda bi detekcija nekakvih nepovoljnih događaja za njih u njihovom kretanju bila važna. Tako da mi tu asistenciju koja bi bila 1 na 1 ili sestra njegovateljica sa svakim bolesnikom često ne možemo naravno ostvariti, ali za jednu šetnju, odlazak izvan sobe, ručak, brinuti o sebi, o svojoj higijeni bi mogao bolesnik učiniti, a mi bismo bili sigurni znajući da ga možemo pratiti. Imali bi sigurnost za bolesnika, sigurnost od nepovoljnih otpada i mogućih ozljeda koje se mogu dogoditi, optimalizirali bi izvore, odnosno optimalizirali bi stav od, kako bi rekla, izvore zdravstvenog osoblja, njihov broj. Bili bi bolesnici zadovoljniji, reducirali bi se nepovoljni događaji. I na našem jednom od zavoda imamo podatak da recimo 20 bolesnika padne godišnje, posklizne, sjedne i slično, a 15% čak imaju i ozbiljne povrede, što bismo na ovaj način mogli spriječiti. Sestre bi bile odmah obavještene, bolesnikova mobilnost i neovisnost od tuđe pomoći tijekom boravka u bolnici bi bila ipak bolja i bolesnici bi naravno trebali dati privolu da nose takve senzore koji bi mogli detektirati potencijalni pad i takav način praćenja rizika pada danas u zdravstvenim sustavima uzima sve veću pažnju i zbog recimo sigurnosti bolesnika, naravno i financijskih opterećenja. Tako da je naš zaključak za drugi izazov, FallPredict, je poboljšati sigurnost bolesnika, dati mu mogućnost da možemo pravovremeno saznati da li prijeti pad takvog bolesnika u pravom vremenu, tako da minimiziramo rizik ozljeda koja su nastala padom i poboljšavamo odgovor za zdravstvene djelatnike i onda bolesnici su u tom slučaju sigurni, mogu držati svoju mobilnost, neovisnost za vrijeme dok su u bolnici, za vrijeme njihovog boravka u bolnici, što sigurno može doprinijeti njihovom i boljem ozdravljenju. Takav jedan solucija ili jedan taj način na koji bismo to rješavali, pretpostavljamo da bi to trebao biti određeni senzor koji bi bio nosiv na bolesnicima, da li na odjeći ili koji bi recimo u pravom vremenu detektirao promjene u stavu u držanju bolesnika i njegova kretanja, da je kompaktan, da je lagan, da je recimo dobro prilagođen koži, recimo korisniku, prilagođen korisniku, da je otporan na vodu, da ima dugotrajno trajanje baterijskog recimo života, da je povezan bežično i tako da mogu na vrijeme u sestre ili liječnici ili ostali biti nadzorom nad takvim bolesnikom i da je na hrvatskom jeziku. On bi u pravom vremenu pokazivao promjene i promjene postura, to jest promjene njegovog držanja tog bolesnika, kretnje koje bi bile odgovarajuće kretnje prijetećem padu i na taj način na pravo vrijeme alarmirali ili davali signal o tome. Mi bi također znali točnu lokaciju gdje se nalazi u tom trenutku bolesnik i uglavnom to mora biti jedan user friendly ili korisniku ugodan jedan uređaj koji bi na vrijeme mogao detektirati taj potencijalni nepovoljni događaj. Bilo bi dobro da može monitorirati nekoliko bolesnika u isto vrijeme. Planiramo da bismo uključili 30-ak bolesnika u tom pilotu, time bismo kasnije validirali našu soluciju, a uključeni bi, praćeni bili 10 zdravstvenih djelatnika, kardiolozi i sestre. Moramo osigurati ono što nam je potrebno za to, moramo osigurati naravno bolesnike koji će pristati i onda koristiti i validirati tu soluciju. To se mora imati odobrenje našeg etičkog povjerenstva, a ti naši solucije bi trebali biti vrlo privatne ili jednostavno udovoljavati GDPR sustavu. I očekujemo da bi onda na taj način pad bolesnika u bolničkim uvjetima se smanjio za 10%. Mi bismo uspoređivali jednostavno dobit na taj način u korist bolesnika ako bismo uspoređivali padove, recimo slučajne padove bolesnika koji to nemaju ili imaju, koji bi bili slični u grupama po dobi i po zdravstvenim kondicijama u određenom vremenu. I očekujemo da će se naravno reducirati te povrede koje mogu nastupiti zbog pada i uspoređivat ćemo taj brzu reakciju zdravstvenog osoblja u onom trenutku kad dobiju signal da se nešto događa nepovoljno u smislu pada u odnosu na one koji to nemaju. Tako da mi očekujemo recimo dobrobit toga da je bolesnik će biti zadovoljan, da će se osjećati bolje i sigurnije ako nosi takav jedan uređaj, da će biti recimo ugodnije mu boravak u bolnicu, da će imati saznanja da će taj sustav jednostavno respektirati njegovu privatnost, i da će se monitoriranje tih potencijalnih padova njemu omogućiti da svoje dnevne aktivnosti ipak bolje provodi nego ako taj recimo senzor ne bi imao sa sobom ili na sebi. Mi imamo u planu 20-ak bolesnika i smatramo da će 60% imati na Likhartovoj skali također pozitivnih odgovora i zadovoljstva sa takvim načinom praćenja. I također ako se taj pilot projekt pokaže uspješan, onda će biti odluka KBC-a ili naših unutarnja odluka da li će se takva solucija, inovativna solucija prihvatiti za daljnje praćenje i za daljnji način kontrole bolesnika unutar bolničkih uvjeta. Nešto o sljedećim koracima koji su sada samo sažetak ovoga što sam kazala, da se to može pročitati na stranicama HealthChain projekta, da se mogu uputiti pitanja na koordinatorima projekta, to su naši suradnici Elena, Mirja, Marija, koji ste sad upoznali Mariju govoreći na ovom Zoomu. Glede pitanja koji bi se odnosili na bolnički centar naš, onda se može obratiti meni u smislu kliničkih nekih razmatranja i suradnicima gospodinu Sandru Krizmanu, Ani Pecotić-Šimunčić, i onda bi trebalo ispuniti svoje nekakve propozale, svoje nekakve ideje i to sve predati prije 16.2.2024. godine. Zainteresirane. Ja se zahvaljujem i sada bih molila ako imate kakva pitanja, možete ih proslijediti na chatu, možete pisati mail, možete upravo se sad uključiti, ako budem što znala kazati, ja ću vam kazati i to bi bilo to i ja vam se zahvaljujem. Thank you very much for listening.
Thank you very much, Theodora, for diving into the two challenges you have proposed at Rijeka Hospital and that the SMEs will be addressing. So now let me check if we receive any question, but not yet. So we didn't. Now there is a question for MediLink. So Theodora, do you want to read by yourself in the Q&A box so you can answer in Croatian? Or do you want me to read? Okay, I will read for you. The question is regarding MediLink talent. So what does it mean to send the referral to the computer system under the name of consultation? Does it mean the system needs to be integrated into the current hospital information system?
As much as I know, I think should be integrated in the current hospital information system. Maybe Sanin would be able to answer it better, but it would be like audio-video consultation. So we all together, me, for example, from the clinical hospital center, and then the doctor of the family doctor and the patient can be together in one audio-video consultation, talking in real time, sending the information in real time. And what kind of devices are there in the clinical hospital center? Do they have digital stethoscope or thermometers? We don't have digital stethoscopes. We do have digital stethoscope maybe for private using. Someone has digital stethoscope, but it is not so usual. But I would like to transmit this digital stethoscope sounds and everything that it can give us to some remote position, like from the ambulance that is in remote position in Goranska County to clinical hospital center. And how they connect?
Theodora, if you need the IT team support to answer some question, they can.
Okay, I can answer these questions.
Okay, perfect.
Okay, first question. No, it doesn't have to be integrated with our hospital information system, but it has to have the possibility to communicate with it over HL7 protocol or standard health protocols like DICOM or anything else. As far as for question number 2, we don't have any digital stethoscopes or thermometers. It would have to be, it is the scope of the project, the digital stethoscopes, you have to acquire them in scope of the project. And as far for HIS, hospital information system, PACS and LIS, we have documentation and we have this kind of systems on premises. So if anyone needs it, we will kindly give it to them. Okay.
Okay, thank you, Sanji, for your answer. So now we have a question from, so Igor wants to say something. So now you can go ahead, Igor.
Great, thank you. Hello, both projects seems very promising, but I have a question since we are living in AI world today about fault prediction. We are talking about sensors, okay, but what about cameras which could predict certain situation also based on computer vision? My question is, could be fault prediction project hybrid systems which involve cameras and computer vision with sensors? That means that a learning process is done by AI and a human expert. And also, if we are wondering what about GDPR, we can blur faces. But what about cameras? Is it possible to include in such project? Because I think that could be a great solution, which could give a great output with data, with prediction, with everything necessary for going on further with such project.
Okay,
So,
should I answer? Okay, the AI is all of the hype right now. So definitely, if you can implement for this kind of price AI technology, that would be really good. As far as for cameras, we didn't have this in the project, but okay, I guess that would be far more expensive than the money that we have to spend for him, because it is not so little of a space to cover with the cameras. But if you think you can do with that, that would be definitely great for this kind of price. Okay.
I see, but just one question. We are talking about pilot project, so we need to have as much data as we can from this. I think that a number of camera shouldn't be such a huge number. We are talking about 20 sensors, 20 patients, and maybe 5 to 10 cameras with blurring effect because of GDPR. But we can get huge amount of information from simultaneous use of camera and such sensors. And we can also working with AI on teaching systems how to respond, because we have a reaction in real time on the camera. We can know if somebody is going to fall, and if it is fallen down, we also have all necessary data to put in accordance with sensor data and make knowledge from that. So I think that such project is great, but I think that it should rely also on using cameras and sensors together.
Yes, visual representation is always good. So as long as the prerequisites are met with the full sensor and applications, the camera can only be added commodity. So yes, okay. I guess that would be great, but it isn't the scope of the project. That is the extra step if you want to take it that way. That would of course be really beneficial to us to have another visual side of the whole project.
Great.
Okay?
Thank you.
Thank you. Thank you, Sanjin. Thank you, Igor. Maria, we don't hear you.
Sorry, really sorry. So I was saying that then if you have further, or if you have further question or any other doubts after the session, you will be able to contact the Rijeka Hospital team, so Sanji or Teodora. So I will copy in the chat our email addresses, but you will also receive the presentation with our main contact details. And we will also send you a follow-up email after the session with our email addresses and recording of the session and so on.
Okay, thank you.
I don't know if somebody else has any question, other attendees that can be interested in one of the challenges, so maybe Marco or Thibro from the other companies that are today attending the session. So we didn't receive more questions, but if you want to speak, I will give you, I will open your microphones. Igor, do you have any question?
Well, I have. When I'm talking about virtual consultant, when we are talking about the first project for supporting a huge area and huge number of possible patients, we are also thinking, we have certain experience, especially in cardio, making cardio apps, and we are thinking about, while we are using that system, AI also could go in the way to learn and became a virtual consultant. So such project, in accordance with our thinking about that, should also think about making maybe a virtual consultant which with knowledge which should be based with expert knowledge of cardio experts in this case. So we are also thinking about that feature, how to use that knowledge, not only by human and human experts, but also how to use that knowledge which is coming every day to us to not just improve our healthcare, but also to make virtual assistant who will be able to work 24/7 with a high degree of certain answers to questions in real time. So just thought about that. I think today projects must be relay on AI, maybe not in substance, but all must have one eye on AI and think how to use data to make something automatically to be done. So and the first project, I think it should be used certain techniques to use that knowledge in real time to the patients.
Yeah.
That is I think that is the next step, and we should talk in the starting of project and the next step.
Can I say, as a standpoint of IT, the rate of exchange between the practitioner and the specialist is, we have a lot of information. If you can capture this kind of information through, I don't know, voice recognition or through some kind of other technology, that would be great to have a virtual consultant with some kind of knowledge database that you will use to power up that kind of virtual consultant, of course. But it is kind of the extra step in this kind of project. So we are currently talking between the communication and the basic medical information between the two sides. This, of course, is the extra step, and it is welcomed. If you can implement that, I think it shouldn't be a problem. But the basic prerequisites must be fulfilled on your part. Okay.
Of course. That is the core of the project, and it's clear. But I just wanted to say that maybe we should think about that step. I didn't say that it must be.
Yeah. Yes, I know the possibilities of AI are really great. So, but we didn't really include this in this kind of project. If we can get this, it is of course welcomed. But the first thing we must comply is the prerequisites of the project itself.
Yes, of course.
Okay.
Of course. The features of the project must be included in the first step. I see that, so of course. Thank you.
Thank you.
Elena, do you want to add something?
Yeah, thank you very much, Maria. So good morning, everyone. I'm Elena, work with Maria. We are coordinating HealthChain. Just to add on this, the discussions have been really interesting. when it comes to the requirements of the potential solution and the functionality. On our end, just to mention that in HealthChain, we are following a demand-driven approach. So the healthcare organization basically state what they need, but then the SMEs, what we call the IT companies, have some freedom to propose the kind of solution that would solve that problem, because we understand that you are the best equipped to make a proposal on the kind of technology that could be done. So that's one thing. We are open to see different proposals to the same problem when you submit your application. And the other thing is that we are looking for a technology readiness level relatively high, so around 6 or 7. So that's why the hospital here really wants to solve a challenge that is challenging, but that is not super let's say, focus on research. We are in an innovation level that is quite high, so that's why we want to secure certain things that could be seen as more basic, but it's also because we need a technology readiness level relatively high, if that helps when you develop your proposal, of course.
Elena, can I just one question regarding the first question that we received? If, for example, if the hospital doesn't have the digital stethoscopes or thermostats or whatever, is it possible that maybe not the SME needs to purchase this equipment, but maybe the hospital can purchase it for the pilot, because we know that they have certain budget they didn't spend on something else? So is this something that is possible?
It is if they have budget allocated on their other direct costs that I don't remember 100% now. But I think that we should check internally with the hospital whether that is possible for them.
Yeah, I mean, of course, we have this public procurement again and again, but I mean, this is something maybe if they have money on the side which they don't know where to spend, maybe this is something that they can purchase this equipment and then also make it easier for the SMEs and also spend that money on something useful.
Mm-hmm. We can explore the possibilities. We think that the best is that the SME purchase that to avoid problems when it comes to public procurement law. But we can discuss with the selected SME. Here we want to make clear to all the participants here that in this case, what if you are awarded, then we will enter in let's say negotiation phase where the coordinator, the hospital, and you will discuss. And then there will be some time to fine-tune the initial plan that you submitted in your proposal. So if we see that you propose a budget that perhaps doesn't make much sense and we can change that, we will do so before you are onboarded in the project. So what I'm trying to say is that there's certain flexibility that is possible if you get selected. We will discuss on a one-to-one basis. I hope this clarifies.
Thank you very much, Elena, for the clarification. I hope it helps to Igor and the rest of attendees. So I don't know if somebody else wants to add something in terms of challenges or expression of interest details. Let me copy and paste them. I'm going to copy to type our in the chat so you can have our contact details in case you have any question. Anyway, I will send a follow-up email as I mentioned before. So feel free to contact us. So I hope it has been interesting for you and you will be you will apply for at least one of these challenges from the Rijeka hospital. And if nobody has any more question or further doubts, I think that we can close the session here and keep in touch. So you have our email addresses and we have yours. So we can keep in contact with you, Igor, and the other participants in this session. So thank you very much, everybody. Thank you very much, Rijeka Hospital team, Andre, Elena, and the attendees for sure. So good luck for you to apply for the expression of interest, and feel free to come back to us in case you have further doubts and concerns in terms of the expression of interest and the two Croatian challenges.
Thank you very much, everybody.
Thank you for your time.
Maria, have a
Thank
nice
you.
day. Bye.
Thank
Bye.
you. Thank you.
Thank you.
Bye-bye.
Bye.